Provide resident a partial bed bath and a back rub. The candidate is asked to bathe a resident who's in bed and who is not able to help with her bathing. For testing purposes only, the candidate is asked to wash just part of the body so that technique can be evaluated. The instructions ask the candidate to wash the resident's face, neck, back, one hand and arm, and chest and abdomen. Soap and water should be used for bathing. The resident also needs a back rub. When completing the skill, dress the mannequin in a clean hospital-style gown, and you have 17 to 19 minutes for this skill. Hi, good afternoon. I'm Joni. What's your name? Marty? Okay. Marty, just want to check your wristband. Marty, I'm here to give you a partial bed bath this afternoon. So let me get my supplies and some nice warm water to do that. Do you have any questions? Okay, I'll be right back. I'm washing my hands. Since it isn't likely that you're going to be coming into contact with anybody's blood or body fluids for the areas that we're washing, we actually don't need any gloves for this skill. You do need 4 washcloths. You need 2 bath towels. You need a sheet that can be used as your bath sheet and a clean gown. I like to place my gown over here so it doesn't get wet in the process of washing up Marty. We need a basin of 105 up to 110 degree water. It needs to be half full. The reason it can be a little warmer is because we're not putting any part of Marty's body directly into the water, and we are going to be using it for a little length of time. So we will make sure that it's the right temperature for her. I'm using a barrier to turn on the water. We'd like the basin to be half full. The more water in the basin, the longer it stays warm. Okay, I'm going to pull the curtains around Marty's bed. Marty, I'm going to take your cowbell away for right now. We'll give it back before we leave, okay? How are you feeling today? That's good. I'm going to lock the bed, or assure that it is locked, and it is. And I'm going to raise the bed to a comfortable working height for me. Marty, I'm going to raise your bed up now. Hey Marty, I'm just going to cover you up with this sheet to help you stay warm while I get your sheet down and out of the way. We don't want this to get wet. So we'll fan fold it to the bottom of the bed. I'm going to untie your gown. If you can just turn over just a wee bit. We'll give you a clean gown at the end, Marty. Okay, can you pull your arm back out of this? Good, thank you. Marty, would you like me to use soap on your face? You said no, you don't want any soap on your face. Yes, it does tend to dry out the face sometimes in the wintertime, but I wanted to give you that choice. Okay, we won't use any soap on your face. Marty, you just want to place this towel on your pillow. It'll help your pillow to stay dry. Can you raise your head a little bit for me? Thank you. Are you comfortable? All right. Marty, the reason I like to use two towels is one towel is basically to dry you, and the other towel is to keep your bed dry. All right, Marty, we're going to start with your eyes, around your eyes, okay? Can you close your eyes for me? And we're going to start with one corner. We're going to wash from the inner to the outer. We're going to change corners and wash inner to outer eyelid. Corner 3 from inner to outer, and corner 4 inner to outer. All right? Marty, I'm going to finish washing your face. How does that water feel? Does that feel all right? Okay, good. All right, I'm going to wash your ear. And get this one. And how about that neck? All right, if you raise your head a little, I'll get the back. I'm going to put that one right back in the basin and dry your face. You lift your head for me. Look at the back of your neck. Thank you. We're going to wash your chest and your abdomen next. Would you like me to use soap there? Okay, I will. Is the water okay? Does it feel warm enough? Oh, good. I'm glad. Okay, I'm going to pick up each breast and wash underneath and wash the abdomen. Marty, I notice a little reddened area under your right breast. I better mention that to the nurse. She probably will want to come and look at that. Since I applied soap to the washcloth, I'm going to get rid of that one. And the second washcloth won't have any soap, it'll be the rinse. It is best to always use a mitt. You always have control of your washcloth that way. And it's not splashing water everywhere, right, Marty? That can be pretty miserable to be wet where you don't want to be wet. Okay, I'm going to lift up each breast, rinse, and rinse the abdomen. Put this back in the basin. Okay, Marty, I'm just going to pat dry now. Marty, can you just lift your head? We don't need this pillow, the towel on the pillow anymore, but we do need it under your arm. Can you lift your arm? Okay, Marty, I'm going to wash your arm and your hand. Okay, we're just going to go in one direction. There we go. We'll wash the hand next. Between each finger. And the palm, the wrist. Okay, Marty, we're going to have to wash under the arm. Can you raise your arm up? Oh, good. All right, let's cover you up and get rid of this soapy washcloth. Okay, washcloth number 3. Just a rinse. Is the water warm enough on the washcloth, Marty? Are you comfortable? Oh, good. Okay, let's get under that arm. All right. Pat you dry. Marty, can you lift your arm one more time? Thank you. Let it dry under there. Okay, Marty, would you like me to give you a back rub after I'm done washing your back? Oh, that sounds pretty good, doesn't it? Sure, I'll be glad to do that. Let's turn over to your side so we can wash your back, and then I'll give you a back rub. Raise this knee. Okay, on 3. 1, 2, 3. Okay, Marty, let me put this towel on the bed to keep it dry and keep you covered up. Yeah, that does feel good? Sure it does. Oh, Marty, I see some questionable moles over here on your left shoulder. Let me mention those to the nurse as well. Do they bother you? Okay. All right, we're going to get rid of this soapy one. Okay, let's put some lotion on. Warm it up. And we're going to start at the base of the spine and go in a circular motion up to the shoulders using both hands. And what we would do is we would give a back rub for 3 to 5 minutes. All right, I'm going to get off this excess lotion. How does that feel? You like that? Okay, and have you roll over onto your back again. Okay, I don't see any wet spots on the bed. I think we were successful, Marty. Keeping the bed dry. I'm going to go get your clean gown on, though, to help you feel nice and comfortable. Marty, can you put your arm in this sleeve over here? Perfect. There you go. Lift your head a little bit and tie this gown. I'll tie it off to the side so you're not laying on it at nighttime. Okay, do you have enough room there? Good. Marty, do you want to be covered up? Yes? All right, I can. Do you want your arms in or out? You want them in? All right, I can do that. I'm going to lower your bed while I take care of the water. How do you feel? Nice and clean? Good. Are you comfortable? Good. open Marty's curtains. Okay, Marty, here's your call bell. Do you want to stay with your arms under the covers or on top? You want to hold on to your call bell? Okay, I can do that. There you go. I'll also attach it to the bottom sheet in case it falls, okay? Can I get you another blanket? Are you warm enough? All right. Would you like me to turn your music on? Your anything at all? Your TV? Have a good rest, Marty. Okay, I'm going to do my pause. I cleaned up, gave her the call bell, going through in my mind. Pause is for just that, pause. Make sure we did everything. I'm going to come over and read my card one more time. I am washing my hands, and I'm done.